Hi guys, welcome back to the channel. So I wanted to talk about this story, more great news in the fight to save children, basically. So a prestigious New York hospital has completely abandoned all of its gender affirming procedures for minors. And this is a huge turnaround. So NYU in Langone announced that it is banning these procedures when it comes to minors. And there's, of course, various reactions. A surgeon who trained with the hospital has now apologized for not speaking up about the fact that these procedures were offered to minors in the first place. So we're going to take a look at that. So NYU Langone Health, a major Manhattan hospital, will permanently axe its transgender treatment program for kids after the Trump administration threatened to pull federal funding. The hospital is discontinuing the program that offered gender-related care for minors, blaming the move, in part, on the current regulatory environment. So these investigations, when it comes to the Trump administration looking into these hospitals and threatening to pull federal funding, it is working. I know it doesn't seem like that at times, but it really is working. They don't want to lose their federal funding. They can't afford for that to happen. And they've assessed that it's better for the hospital to do away with these procedures. Do I think it's because they had a realization that what they are doing is wrong and they want to protect children? Probably not. It's the threat of losing their federal funding that is working. Hopefully you guys can hear me. If you could put a 1 in the chat just to confirm. Hi guys, thanks so much for joining. Great to see you guys. So they said, okay, given the recent departure of our medical director, coupled with the current regulatory environment, we made the difficult decision to discontinue our transgender youth health program. A NYU Langone spokesman told the Post in a statement on Wednesday, "We are committed to helping patients in our care manage this change." We're committed to helping patients in our care manage this change. This does not impact our pediatric mental health care programs, which will continue. Maybe they should have just focused on that to begin with, offering, is it psychotherapy, counseling, that sort of thing, psychiatric help that doesn't involve chemically castrating children. The hospital's website landing page for such care now reads Gender and Sexuality Service rather than the previous Transgender Youth Health Program. And NYU Langone was one of several high-profile hospitals to pause its gender-affirming care for youth after President Trump threatened to remove federal funding from medical centers treating trans minors late last year. So great news. And of course, people are questioning the motives, but I think it's obvious. It's the threat of losing the federal funding. But I find it interesting, some of the reactions to this story. It is very good news, though. Hi, guys. Thanks so much for joining. So let's take a quick look.
All right, welcome back. A top New York City hospital now says it will no longer offer transgender surgeries for children. NYU Langone Medical Center cites the current regulatory environment as the leading factor in making that decision. Let's bring in Dr. Mark Siegel, Fox News senior medical analyst, also professor of medicine and practicing internist at NYU Langone. Doctor, I guess big picture question here is, were you part of this decision-making process? Do you agree with the outcome? And do you think it's going to serve as a model for other U.S. hospitals?
I was not part of the decision-making process. I agree with the outcome with one provision. We have to continue mental health support for young people that are having gender dysphoria, which is, by the way, 60 to 80% of the time goes away or diminishes. But mental health support is key, and that is still in place at NYU, and I applaud that. We also have to look after those that are no longer in this program. What's happening with them? Where are they going to get their care? That's also important. This change not only involves surgeries, it also involves the use of puberty blockers, and hormone therapy is going to stop. I actually agree with all of this for children. It's already the case in the UK. It's the case in parts of Europe. Here's why. Because first of all, over 10% of children then detransition, decide they made a mistake. Secondly, puberty blockers with hormones can have long-term medical effects, in my opinion, including behavioral issues, including bone issues and fertility issues. You know, we're seeing more and more issues regarding anxiety. I think mental health support has been prematurely stopped. I think there's too much parental overlay. And you talk about detransition, obviously very hard to detransition from a mastectomy.
So great news there. And yeah, I totally agree. So he's saying, focus more on just offering the help that these young people need when it comes to their mental health, which is what they should have been focusing on rather than always jump into procedures that permanently alter their bodies. Makes no sense whatsoever. And he admitted, they grow out of it. I remember once upon a time, you weren't allowed to say that. That was called bigotry, to say that a child can grow out of gender dysphoria. And now they're admitting that. So Billboard Chris, his reaction, he has worked tirelessly to create awareness about this topic. NYU Langone, a major hub for child transition, announced today they are stopping the practice due to pressure from the Trump administration. Thank you for protecting kids, President Trump. This is so big. And Danny had previously stated he would turn NYC into a trans sanctuary city, promising to spend $65 million per year transitioning kids from around the country. So, wow. Thank God that ridiculous plan is not going to come to fruition now. I just don't even know the logic behind such reasoning. And notice these idiots didn't say they are stopping because it's the right thing to do, but because regulatory requirements made them, just like US OPC, NCAA, Penn, no moral compass. Exactly, Valerie. They were forced to. Thank God they were forced to, but, it's very disappointing that this is what it takes for them to do the right thing and take actions that are going to protect children. So this doctor here, I find this, we're going to react to his interview, saying that, he regrets not speaking up about this in his, his capacity as a surgeon, I'm assuming. So let's take a look.
Hear a renewal by Anderson. Did you know that choosing us to...
While the commercial plays, I'll just see if there's any other reactions. So yeah, they said they're going to continue offering counseling, as if that's some sort of new thing.
A major hospital here in deep blue New York City, NYU Langone, announcing it will no longer help children switch genders and is stopping all transgender surgeries for youth patients. Our next guest is a plastic surgeon who trained at NYU and recalls not having a choice to help with these procedures and says that he regrets every single one. Dr. Ira Savetsky joins us now. Ira, thank you. Dr. Savetsky, sorry, I'm friends with you and your wife, so I'm used to saying Ira. Thank you so much for being here. Tell me what your training was like at NYU and what you had to witness when it came to children and these surgeries.
Well, Ainsley, first of all, thank you for having me. First I want to start off by apologizing to all these children who underwent irreversible, life-altering surgeries. And as a father to 3 young children, and as a physician who took an oath to do no harm, I failed to speak up. And I just want to thank President Trump for having more clarity on this, and our society finally came out strongly against this. So, like you mentioned, training. You're at the #1 plastic surgery program. You're just grateful to be there.
Mm-hmm.
There's no room to speak up.
Right.
You're a soldier.
Because if you left, you wouldn't get your degree. You wouldn't become a doctor.
Yeah, you work so hard to get there. You don't want to make waves.
Right. I understand that. You're young. You're, right out of medical school. Now you're in training, I guess. And you don't want to speak up because you have these older men that you respect, or women that you respect so much, that are these surgeons. What did you see? What did you have to witness? How old were these children that were on the table having these surgeries?
As young as 13, teenagers. I can only imagine what the parents were going through. I mean, they're told that their child is going to kill themselves if they don't have these surgeries. They're pressured. And what are you supposed to do? You drop everything to do the right thing for your child. And, I think that unfortunately there was a lot of financial motivation with these institutions. 2016, New York State passed anti-discrimination laws.
That's a lot of it too. Right. Well, now they're saying, so what happened in this case? The medical director left, and so they changed their website. Used to say Transgender Youth Health Program, and now it says Gender and Sexuality Service. And this is what NYU Langone, this is what they have said. Given the recent departure of our medical director, coupled with our current regulatory environment, we made the difficult decision to discontinue our Transgender Youth Health Program. And if you look at the stats, Dr. Savetsky, 724,000 transgender children ages 13 to 17 in our country. That's 3.3% of our U.S. Youth population. They're identifying as transgender, not necessarily having the surgery. Mm-hmm. In your experience, when you would watch these children have the surgery, what advice would you give to their parents if you could talk to them now?
Well, as physicians, we're supposed to follow evidence-based medicine, and so much of the data did not show that what we're doing was the right thing. The goal is to prevent suicide, to improve mental health in the youth, and the data did not show that. Mm-hmm. So we failed them. We failed the children, we failed the parents, and I'm deeply regretful for not speaking up.
Yeah, I think when you become of age, this is America. We have freedoms. You can do whatever you want to your body. I think the fear here is we want to love the child and we want to support them. Don't want them to commit suicide, but also don't want them to make a decision that they regret later in life and won't be able to breastfeed or have babies or whatever it might be. Thank you so much for coming on with us.
Wow. So, I appreciate him saying what he said. As a doctor, that couldn't have been easy. He's admitting to going along with, one of the greatest crimes of the century, as far as I'm concerned. Like, if you know what I mean, in terms of crimes against humanity, I think this is going to be up there. When we look back at this time, we're going to look back and think, what on earth did they do to children? When we look back at this time. So yeah, I appreciate him saying what he said. Some people are saying, they're not very convinced about him saying that he had no choice. I saw one comment where you said, it's always a choice. There are people who choose to take a different path because they don't want to be a part of, transitioning children. There will be people who chose to take a different path in order not to be a part of that. So, I do agree that there is always a choice. But yeah, if you want to qualify as a doctor, during that whole period, you had to be willing to go along with certain things, obviously. So I want to see more doctors come forward and condemn what has been allowed to happen and how far they were able to take it. I want them to come forward and condemn this. There is also the issue of they don't want to make themselves liable by, admitting that what they did was wrong. There's legal ramifications as well. So maybe that's also an issue. If the mainstream media covers this story at all, they will spin it to make it seem that Republicans are taking medical care from needy children. Yeah, of course. That's how they've been spinning it. I mean, the fact that he was saying this was based on preventing children from unaliving themselves when there was absolutely no evidence or proof of that whatsoever, that these barbaric procedures were linked to preventing kids taking that route. No evidence whatsoever, but they would make these assertions to parents to put pressure on them. And this was allowed to go on for years. And when you say, you know what, I don't think it's a good idea to allow children to block puberty. I don't think it's a good idea to perform surgeries on children, on teenagers, teenage girls having double mastectomies. When you say that's not a good idea, they will tell you that you're for kids taking their lives. That's how ridiculous. How do you go from that to making that assertion? And for the longest time, people are second guessing themselves like, wait a minute, is this not just common sense? So I'm glad that things are turning around now, and these hospitals, organizations, they are admitting that, well, I don't know if they're admitting, but they're at least saying they're not going to continue these barbaric practices against children. So just another reaction which I found interesting before we go. This was going to just be a quick live. So we have Dr. Andrew here. I don't want to butcher his name. He had the following to say about this. Let me just double check you can see that. Are you watching this? These same people destroyed my entire life and career, called me a liar, a fraud, and to this day, slander and harass me for saying basic truth the day I found out about this. Now they are all pretending to be white knights, reasonable and scientific. This is absurd. So this is a doctor who did make the right decision to not be a part of this and to call it out. And he faced the consequences. He's saying, he was slandered. They tried to destroy him because he spoke out. Unlike the doctor, we just watched, who apologized. So, this is a reminder to never forget what these people did. They all want to act as if they're on the right side of history when they were for the chemical castration of children. They were for performing surgeries on children, permanently altering the bodies of children, completely based on a lie, with the promise that they can transition into the opposite sex. This is what doctors endorsed for the longest time. So I'm glad, this doctor is speaking out and reminding us to never forget what they allowed to do in the first place. But it is good news that they are at least acknowledging that this needs to stop, or I guess they've been forced to. The main thing is that this isn't going to continue to happen to children and young people in this country. Nearly 70% of Bay State health patients rely on Medicaid and Medicare, and preserving access to care for these individuals and all others in our community is a responsibility we take seriously. And that was a statement. Just share this with you before we leave. They are trying to act like they're being all reasonable and scientific now, when for the longest time, all they were doing was following an ideology. Yeah, so Mandani, he did pledge this whole $65 million. Can you imagine? Of taxpayer funds in providing help for trans New Yorkers, including minors. So Bay State Health, the largest healthcare system in Western Massachusetts, also announced it would stop prescribing gender-affirming hormone treatments to those under 18 years of age amid threats of funding cuts. So the hospital said that it would continue offering counseling services and would redirect underage trans patients to a local facility for their prescriptions moving forward. So yeah, this Bay State Health said the decision offers patients the specialized expertise and continuity of care they need and deserve, and reflects the evolving regulatory landscape that threatens hundreds of millions of dollars in hospital Medicaid and Medicare funding. So, you know, they're saying that we want to make sure we protect the funding that's so important to our patients. And this is just the changing of the landscape of care. So no one's buying that. You were forced to. WTF does gender affirming even mean, though? Affirming a delusion. Yep. What does that even mean? This is the euphemisms they use to justify these barbaric practices, this terrible experiment on children that they've been doing for the longest time. Yep, this shouldn't have happened in the first place. Exactly, B-Flower. Should never have happened in the first place. And went on for so long. Went on for so long. So just before we leave, let's see what else you guys are saying. Yep. Stacey said, we call it help when they are castrating people. Insanity. Absolute insanity. So I'm happy to hear this news, and I'm sure you guys are more relieved, really, that more and more hospitals are saying they're going to stop this gender affirming care in these woke states, simply because the Trump administration are saying that it's going to pull the funding, and they deserve to have their funding pulled if they're doing this to children. They're continuing to do it despite executive orders. You know, federally, it's not endorsed anymore. And yeah, it is working, and it's happening slowly, but at least we can rest assured that no more children, you know, in these blue states, in these big cities, where they've said that they're going to discontinue this, these procedures, you know, are going to be lured into buying into a lie and permanently damaging their bodies. So we can be happy to hear that at least. Hello, Uta. Let's see what happens with the next 24 malpractice cases now. Exactly. I'm all for more and more of these detransitioners seeking legal action against these hospitals, against these doctors, these psychiatrists. Let's see more and more of them win their cases, or at least get settlements. That's the least they deserve after going through what they've been through at the hands of predatory adults, as far as I'm concerned. So thank you so much, guys, for joining. And Uta, I'll be in touch. We need to do a live together very soon, in light of recent events especially. So yeah, I will see you guys in the next video. Take care of yourselves and look out for more to come. And yeah, enjoy the rest of your week. Enjoy your weekend when it comes. And thank you for joining the live today.